Hi, welcome to my podcast. This is Dr. Quadri. I have Amir Akhawan. He's our third year medical student who shadowed with me. And so we are going to talk about what his experience of medical school has been and what were the challenges, and then also what was the rotation like with me. So go ahead, Amir. Tell me a little background of yourself.
All right. Thank you for having me, Dr. Quadri. It was great rotating with you during my second and third year. A little bit about me. I'm from Los Angeles, born and raised. I am now actually a fourth year medical student starting this week at TCU Burnett School of Medicine. And that's pretty much about me. I love playing soccer. That's my main passion outside of medicine.
Okay. All right. Good. Good to see. Welcome. I want to start like with first, what was it like first before going into medical school? What some of the challenges you had to face before going into medical school?
A big challenge actually was probably COVID. COVID was 2 years before I started medical school. I was in college. But that actually allowed me to, I was able to do school at night. So I was able to pick up a job during the day as a medical assistant for a doctor. So it kind of helped me out in the long term in terms of applying to medical school. I got good experience with clinical patients, interacting with patients, things like that. And then I could do my school at night because everything was online from COVID. So it kind of worked out. Other challenges, just taking the MCAT, dealing with hard classes, biochemistry, organic chemistry, physics. Those are probably my main challenges before going into medical school. But then obviously going into medical school was a completely different beast.
Right. What advice would you give to somebody who's a pre-med student right now? What would you tell them?
Um, I would say the main thing would be just get as much experience as possible in different fields of medicine. Not in terms of figuring out what you necessarily want to do in the future, but just getting your feet wet, interacting with patients, just seeing that side of medicine. It's very like it's easy, not easy per se, but the easier part is learning everything because at the end of the day, you're gonna learn, you're gonna study, people will teach you things, but the interpersonal skills that you taught me a lot of during my rotation with you, that's the challenging part, dealing with human beings, dealing with emotions. I feel like getting your feet wet as much as possible with clinical experience is the main thing.
Okay. So that's kind of more the medical experience. What about people who have not got into medical school yet? What would you give them advice? Like they're still in the pre-med era, like if they're still applying, what would you tell them?
In the pre-med era, I would say just do the best you can with your classes, learn as much as you can. Always be open to taking advice from other people who may have gone through a similar process.
Hmm.
And just also staying true to who you are. I feel like it's easy to lose yourself in all the stress, anxiety, like
Yeah.
pressure from parents, friends, whatever it is. Just staying true to who you are and not letting it take over your whole life per
Yeah.
se.
Yeah. Have a balanced life. So now once you got into medical school, so how did you maintain that balanced life and what were the challenges in medical school?
Yeah, so that was very hard. First year for my school, we do 1 year or 15 months of just classes, learning, book learning, and then we started rotations after the first 15 months. So the first year and a half was challenging in the sense that we had to study a lot on our own, and it's just nonstop, so much information you need to learn, tests every 3 or 4 weeks or so. That was challenging. That was something I wasn't used to. And it's just very fast paced. I feel like a week of information in medical school is like 10 weeks of information from college. So it's everything is compiled so tightly. You have to learn so much so quickly. But studying with your peers, things like that, staying on top of everything is super important, I would say. And also just having a routine. That's one thing that got me through it. Just I had a routine. I just stayed by it no matter what, basically.
Yeah, routine makes sense because that way you make sure you everything is getting done right. Because if you don't have routine, then you miss out things. So I guess what did some of the things you did to keep in routine? Is there like do you have a schedule planner or did you do certain things certain time of the day? What do you mean by routine?
Yeah, so I always had a calendar. I always like to write things down. Like on Sunday, I always write things down for the week, for each day, things I want to do, what time I'm doing them, things I want to study. And I would try to go to the gym at least 4 or 5 times a week. That was a big part of my routine. Try to wake up early, easier said than done, especially if you're staying up late studying. But
Yeah.
that was a big thing because I feel like my brain was always fresher in the morning so I could study more, get things done, even go to the gym sometimes earlier.
Mm.
and just always making sure that I stay true to that no matter what. Even like if one day I feel a little lazy or tired, I just tell myself, you got to do it. You got to stay on that routine.
Yeah, definitely. Yeah, routine is the key thing. What about like how did you deal with disappointments? And I'm sure you did the journey of medical school, getting into medical school, and then coming in medical school. There were some expectations you had, and then that didn't lead to so much. And how did you deal with those disappointments? And what would advice you give to somebody who had disappointments?
That's a good question. In terms of disappointments, I feel like throughout medical school or throughout any journey in life, there's gonna be bumps on the road. It's you kind of have to have a short memory, if that makes sense. I heard a preceptor once tell me you have to have a memory of a goldfish. You have to forget things very quickly and just move on to the next thing because there's always more. There's always more challenges. There's always more obstacles. So it's easy to just think about what happened in the past, feel bad for yourself, and just keep thinking about that. But the harder thing is just to look in the future and just keep moving forward and keep pushing because
Yeah.
there's going to be more challenges and more ways to step up, basically.
How do you keep yourself motivated?
Oh, that's a good question too. I think my family plays a big role in motivation, honestly. Just talking to my family, them telling me how proud they am of what I've achieved. I feel like that's my biggest motivation. And just also thinking about my past self and the promises I made to him, just kind of those are the main things I would say motivate me.
Oh, okay, so just kind of have some. Do you have like do you reward yourself like short term rewards, short term motivation? Do you ever do that?
What do you mean by
Like
that?
if you accomplish something you did you studied for the test or you studied for that week and you accomplished that goal. Do you have a time set for yourself to like reward yourself? But
I
how are
do.
you, I guess how do you relax and how do you reward? What do you do to keep yourself moving and
Yeah, that's a good question too. I would say I do reward myself. I would say maybe what I do is tell myself I've earned 30 minutes or an hour of playing video games.
Yes.
That's like a reward. If I do well on a test or if I've studied a lot and I just can't study anymore, that would be the main thing I would say. Or just spending time meditation, yoga, exercising, those types of things.
So those are kind of things. What about do you ever feel guilty if you reward yourself too much, or does that ever happen?
Yeah, that's been a main issue with medical school because there's always so much. You always feel like you can be doing more. There's always more to do. So even if for example, it's a Friday night and I go out to watch a movie with my friends, I feel like it's become natural for me to feel guilty that I should be studying, I should be working on something. So that's something that's been challenging for me throughout these 3 years, but I feel like slowly I've gotten better at dealing with it. But it has been a challenge to deal
Yeah.
with it.
Yeah, it is. And because I agree with you. There is so much to cover in this short amount of time, and then you feel like you haven't done much. And if you do go out and do something, then you feel bad, like, oh my God, I didn't. I guess like what you said is good that you should learn to let go. You need to celebrate those small gains, and then the other thing, anything in life that I've seen is being consistent, right? So being consistent in what you're doing and not give up because you will have hurdles in life. That's very common. And I don't know anybody who's successful who didn't have failures.
Yep.
The failures should not stop you from achieving yours. Failures just kind of teach you. They become your teachers, right? Isn't that I've seen in my life? I've faced a lot of failures in my life, going from starting from pre med to medical school and getting into residency. There's so much hurdles I had to go through and expectations I had, and still sometimes I didn't meet them the way I wanted, like the specific time frame, and then you have to kind of some people have to take a gap year, right? I guess unfortunately you didn't have to, or did you, or you were able to get in right after, or was there thing like that for you?
I did end up taking a gap year between medical school and undergrad.
And so how did that go? I mean, like, was that planned or is it unplanned or?
That was planned actually. So I kind of started the process of taking my pre-med classes pretty late on. Beginning, I was taking economics classes in college. I didn't know what I wanted to do. I had a lot of classes to get through, so I had decided I would take a gap year, and I was just working as a medical assistant during that gap year and doing a little bit of research, which I think helped. I think it's tough to go from continuous school to even harder school, so I feel like that little gap where you have no school does help you out in the long term.
How did that help you out? What do you mean?
I feel like that year where you don't have to study, you don't have to worry about taking tests, it kind of takes a little bit of pressure off so that when the stress starts again, you're more able to conquer it.
Oh, that makes sense. I mean, I think so. So you're not going stress to another full stressful environment. So you're kind of like washing out like your stress and then relaxing and what did you do for your gap year? I mean, like what was it, some research or what were you doing?
Yeah, so I was working in a neurology lab at UCLA,
Mhm.
and I was also working full time for a pain management doctor as his medical assistant.
Okay. So did that help all these experiences as a pre like somebody who's in pre-med getting into medical school? So you mentioned that experience. What about like the for the test? Is there anything specifically you did to do well in MCAT or how did
For MCAT, yeah, I took a MCAT course, and I still have my pile of books from 4 years ago that when I was studying for it. I went through all those books. I took a course, which helps definitely, but it's a challenging test. I feel like you need to put time into it, learn the strategies for answering those questions correctly. It's a long, challenging test.
Yeah, I think it's worth it in long term, right? So let's come to now. You're a medical student. You did some rotations, and you came to me as a psych resident. So somebody who's going to be doing a psych rotation, what do you think they should? How should they prepare themselves for a psych rotation?
For a psych rotation, in terms of outpatient or inpatient or both?
Both. I mean, I guess both. I mean, they'll be doing both, right? What?
Yeah.
Yeah.
I would say the main thing would be focusing first on the patient. I feel like as students, in our heads, we have checklists of we need to get this information, we need to figure out everything that's going on, we need to get a diagnosis, we need to treat them, etc. But I feel like what helped me, especially with the patients I saw with you, is that the first goal should be to make a connection with the patient and allow the patient to trust you, and then when you do that, in the end, you get a lot more out of the connection, out of just talking with the patient. They'll tell you more, they'll trust you. And that I feel like we are kind of trained that everything is a checklist. We just have to check the boxes,
Mhm.
figure this out about them, and then move on to the next thing. But that doesn't really help you make a connection with the patient at the end of the day.
Okay. So I guess having your checklist, is that what you're saying it helped you? Kind of having that before going in? Is that what you said? Something like that?
Yeah, yeah, and just focusing and having the patient as the main goal of everything, just treating and helping out that patient.
Yeah, exactly. So it's kind of more patient oriented rather than just kind of trying to be like, I know the book and the material academic that it's important, but don't forget the patient piece that they're more important. That where you learn the most. Yes, you have the books, you have all the material, but there's so much you can learn from that. But there's that, patient interaction is it's more of that's something you have to experience to learn it, right? Is that what you're saying?
Definitely. Yeah, exactly. 100%.
Yeah, that's true. What is unique about a psych rotation? At least with me, what was unique and what did you learn and what were your thoughts before coming in? What were your expectations and what was it like?
Honestly, yeah, I didn't know what to expect before starting my rotation with you. Uh, just some things that I remember that stand out is some patients didn't want to talk to me or just get upset, and just navigating those situations I think taught me a lot. But I really had a great time. I enjoyed talking with all the patients. I really enjoyed my afternoons with you.
What was it that you do you think you learned from psych rotation that's going to help you overall as a physician?
Just dealing with different types of emotions. For example, I'm starting in the ICU next week. It's gonna be a tough month, but I feel like in that setting, I'll also be around a lot of different emotions, family members, even the patients, just navigating how they're feeling, making connections, like I said, and just knowing what to say and when to say it, how to comfort patients, how to put yourselves in their shoes. There's a lot of different skills that I've seen you put to use, and I've been trying to pick up along the way as well. Just
Yes.
just those types of things.
Yeah, definitely. Like I we talked about validation, empathetic statements. They play a long role, right? When you are interacting with somebody, especially when somebody's struggling, and they just somebody needs to be listened. They want just to be heard. So
Mhm.
that plays a big role, and that's a big part of psychiatry. It's have being empathetic and validating. So it's a very good skill to learn, and which you could use in any aspects of medicine. Yes, yeah, that's true. Anything that stands out that you want to give advice to future medical students who will be doing psych resident rotation in inpatient or outpatient? What would be their advice?
I would say, just in general advice. Is that what you're asking? General
Yeah, like in general, what would that be? What would that be?
in general, it'd be just to not be stressed yourself or anxious about everything that's going on. I feel like it's easy to get caught up in what's going on in the life of the patient that's going wrong, but you need to be that pillar for these patients. So you need to be the one that's strong and not necessarily put your emotions to the side, but be able to portray yourself in a manner where the patient can kind of lean on you. It's easy for students to feel like there's a lot going on in our own lives. We have tests, we have things to worry about, but we need to put all that anxiousness and stress and self-doubt to the side while we're talking to patients and just be that strong pillar and support for them, I would say.
Yeah, that's right. Well, I think that kind of summarizes my questions. Did you had any questions from me? I mean, I think you did good and saying kind of helped people students who are going to be coming in. I really appreciate you coming in. Yeah, that's good.
Thank you, Dr. Kwaji. I guess my
Yeah.
only question for you would be, what are your goals for your students after they leave your rotation?
Yeah, I mean, I think my it's always been is that doesn't matter what field you're going to go into, you will encounter patients who are going to be struggling emotionally in that moment of life, right? It could be somebody who's always had problems, chronically, but or sometimes it just kind of going through a medical, stressor will bring those emotions, and then how do you deal with those? And that's my goal with my students, just kind of learn like to how to validate, how to be empathetic, see the patient as a whole, and then just learn how to talk to them and just be there for them. And that's so important, because once you have that basically what I'm saying is building that relationship. To me, it's very, very important. And if when you have that relationship with your patient, then you will be able to not only help the patient, you'll help to help them feel better, at least emotionally, and build that trust, right? Because that's important too. Because if you don't have that trust, then you don't have that relationship. So that's kind of what I want my students to come as a, when they come rotate me, I want them to have that ability to, like you said, it doesn't matter what situation they're in, they're able to handle it and manage through it, and they not get overwhelmed or learn things like tune into their feelings, what they're feeling at that moment, and then realize that it's just it's not about them. It's just the situation that's going on. Because it could be because of this is what the patient is feeling, and they could be projecting those feelings to you. So assessing yourself, where you are at the moment, and then being objective at the same time. So yeah, that's kind of my expectation. And of course, and academically, we go through a lot of not only that, then we go through differential diagnosis. We talk about different treatment plan, different medications, and then all that. And we also have gone over some questions related to board exams. I talk about those too. And the more in the clinically, what I highly emphasize is interview skills, mental status exam. Those are kind of the big things for me. And then once the relationship is, they learn how to build a relationship. So those are kind of big things for me. But yeah, overall, I think, and then the just kind of interviewing patients. I think that's another. I like to kind of watch and see you guys interview and help you get through, navigate. Like you said, you enjoyed the part. You saw some difficult patients, some easy patients, and that's the best part. I think it's like you yourself doing it, and there's supervision. And then if you're struggling, I'm there to help you, and at the end, and come in and pick up. And then, and of course, when I'm interviewing, obviously, you guys are watching and seeing how I navigate, through a difficult patient or an easy patient or something. Good question. Yeah, I really appreciate you coming in and telling us. We'll have more of these. Well, next time when we meet, we'll talk about more specific psychiatric issues, like maybe talking about different diagnoses, personality disorders. And we'll talk more. Thank you so much for coming over.
Definitely. Thank you, Dr. Kwaji, for having me.